Hi, this is Suraj Chetan, founder and CEO of Hands On Tummy. In this video, I'm going to talk to you about a gastrointestinal disease that affects 45% of Indians and 35% of people worldwide. Gastroesophageal reflux disease, acronymed as GERD. What is the definition of GERD? It is a chronic condition where stomach acid passes back into the food pipe, irritating the lining of the food pipe. So, what are the symptoms of GERD? You can experience a burning sensation in your chest. You can feel that you have a lump in your throat. You will also experience backwash of sour liquid or food particles in your throat. You will feel nauseous, you will have repeated burpings, and you will feel tired overall. Considering the damage this disease can do to people, it is very important to understand how this disease works and how we can solve it. And that is exactly what we're going to do in this video. Now, let's look at the causes of GERD. I'll be listing the causes without any specific order. H. pylori infection, sleep deprivation, eating large meals or eating late at night, eating very spicy, fatty or processed foods, certain antibiotics or painkillers, smoking, drinking alcohol, caffeine or other aerated drinks, stress, anxiety and depression, other factors like obesity and pregnancy. Now we know the definition, symptoms and causes of GERD. Now let's look at what happens if we don't treat GERD. Esophagitis. In this condition, the esophagus is inflamed. It causes a lot of pain, difficulty in swallowing and chest pain while eating. Typical treatments include proton pump inhibitors and antacids. Esophageal stricture. In this condition, your esophagus becomes abnormally narrow. This is often accompanied by dysphagia or difficulty in swallowing. Typical treatments include dilators, stent placement and surgical procedures. Barrett's esophagus. This is a condition where the esophagus lining becomes thick and red. This can be deadly as it can lead to cancer. Treatment includes antacids and proton pump inhibitors. Ulcers. These are typically known as peptic ulcers, which are basically sores that occur in the upper digestive tract when the layer of mucus is eroded. And finally, cancer. If the conditions are not treated and you are among the unlucky few, then it can lead to upper gastrointestinal cancer. And trust me, you do not want to let it go that far. Very scary, right? But do not worry, I will teach you how to prevent and cure GERD. First and foremost, eat smaller quantities more often. That is, eat 4 to 5 meals per day, but make sure you eat less in every meal. When you do this, your stomach is not overloaded and the chances of acid reflux or GERD is very less. Secondly, avoid spicy, fatty and processed foods. This is not an ultimatum. You can still have them, but in moderation. Your last meal should be at least 1 to 2 hours before your sleeping time. If you do this, your body will have enough time to send the food down. Eat alkaline foods and drinks when you have acidity. For example, banana. To know more about which alkaline foods and drinks are good for you, watch this video. We will leave the link in the description. Avoid alcohol. Practice moderation, it is needless to say. Do not drink caffeinated and aerated drinks, especially when you are experiencing acidity. Fix your sleeping position. Sleep on your left hand side. If you are sleeping on your back, sleep in a manner where your head is elevated. Eat and drink slowly. Chew your food properly. This simple act of eating right can do wonders for you. Exercise regularly. Move your body. Just walking for 30 minutes can make a huge difference. And for all the smokers out there, I have very bad news for you. You got to quit smoking completely. There is no ifs and buts. You got to quit, man. And my final tip for you. Start using probiotics. Probiotics can control acid reflux and heal your damaged esophagus. We have a wide range of probiotics, but I would suggest you to use Hands On Tummy A or Hands On Tummy B. Either of these two are perfect for GERD. You can take 15 ml after each meal to a maximum of 45 ml per day. So, we have come to the end of this video. I hope this video was educational. If I have provided some value to you, please show some love by liking this video. Also, subscribe to Hands On Tummy official YouTube channel and share this video with someone who might be suffering from GERD. Until next time.